a 33-month-old Hmong girl with severe epilepsy, has gone through numerous emergency visits and 11 hospitalizations. Her medication regimen changes frequently due to the physicians of Merced Community Medical Center and their good intentions of controlling her progressive and unpredictable condition with fine-tuning. The parents, Fao and now Kao, however, have failed to keep up with the complicated drug regimen because they do not understand English and lack faith in Western medicine. Leah constantly misses doses, often resulting in uncontrolled seizures. The caregivers are exhausted and desperate. Neil, one of Leah's physicians, makes a brash decision to report these findings to Child Protective Services and requests she be removed from the home, which the state immediately grants. We find that a sit-down meeting among the Lee family, an interpreter, and doctors may have been helpful. Simply removing himself from the hospital environment alone, Neil may have rid the white coat fear, intimidation, and lack of trust Fao and now Kao had for him. Neil should have made a house visit for a cross-cultural medicine consultation, allowing everyone involved to have a better understanding of what Leah is dealing with. Instead of saying, "Give this drug at this time," he could have delved into their culture and explained it like, "In order to help her soul get better, we should try this." Using the Hmong language and beliefs to explain the potential consequences of not understanding and complying with the medication surely could have helped Leah's progression. After sending the Lees home, Neil sat in his office, staring at Leah's chart, feeling frustrated. He hesitated at the last minute before sending out the request to Child Protective Services. Neil decides to visit the Lees' home after talking to one of the Hmong leaders on the phone. The Hmong leader agreed to go with him as an interpreter.
Hi, I'd like to go to the Lee's home to talk to them about Leah. We all have Leah's best interests at heart, and I want to make sure that I understand their culture so that we can treat her best. As an influential member of their community, the Lees might be more receptive to this conversation if you are present. Can you please arrange this meeting and be our translator?
The next weekend, Neil and the interpreter go to the Lees' apartment and knock on the door. He did not feel welcomed by the Lees. They were frustrated by the experiences at MCMC. 3. In the Lees' house, Neil tries to explain the complications to the Lees, hoping to persuade them to comply with the drug regimen. The conversation did not go well. The barriers between them were not language alone. The interpreter told Neil the Hmong would rather consider Leah's condition as a blessing than a medical problem when Neil asked about their opinions. Culture seems deeply rooted in the different beliefs in medicine.
I know you love Leah very much. I also want to help. What do you think is the cause of Leah's problem?
The interpreter explains to Neil that the Lees believe she lost her soul when her older sister slammed the door to the apartment. She now has spirits inside of her and may grow up to be a shaman. They are proud that she has been chosen for this.
Oh, what an honor to become a shaman. But don't you think Leah is too small to take on such an important role in communicating with the spirit world? Her spirit needs some help to become stronger so other bad spirits cannot harm her. I think the meds could help. They will make Leah's spirit more stable and add more strength. Would you like it if I changed to the other meds to make it simpler for you to give them to her?
They tell the interpreter yes. They do want to strengthen Leah's spirit, but they are afraid the new drugs could make Leah suffer.
Mr. and Mrs. Lee, don't you worry. The new medications I'm about to prescribe for Leah could strengthen her, but Leah might experience some common side effects, which if at any time you feel they are too unbearable, too suffering, you tell us. We will adjust appropriately, but with all my heart for Leah, I will make sure Leah will not suffer from anything. Now, I understand this is a hard decision for you, whether or not to keep trusting us. Please take the time to consider, and I will be here to answer any questions you might have.
Now Kao tells the interpreter that they will give it another try.